think about those times, right? You need a doctor, but it's not really a huge emergency.
Yeah, like a bad sore throat or maybe a cough you just can't shake.
Exactly. Or you pulled something weirdly at the gym. You just want it sorted like now.
Uh-huh. And that's where these, dock-in-a-box places come in, the retail clinics.
They seem to be everywhere now.
They really are. And, well, they're a big part of U.S. healthcare delivery now.
So today we're diving into a study on this.
Yep, called an integrated methodology for evaluating patient service quality. It gives us a really good way to look at what patients actually value there.
Okay, so it's not just did you like it? Yes or no?
No, no, it's deeper. What are the underlying needs? What makes someone satisfied versus, well, dissatisfied?
We're trying to get past just the surface level stuff.
Exactly. And the study uses patient surveys, quite detailed ones actually, and this thing called the Cano model.
Cano model. Sounds interesting.
It is. It helps categorize quality aspects. Plus, they looked at demographics like how age or gender affects things.
Gotcha. So our mission for this deep dive is really to pull out the key insights about patient needs in these U.S. walk-in clinics.
Right. What makes a good experience? Where can they improve? All from the patient's viewpoint.
Okay, let's start with the basics then. What exactly is a walk-in clinic? Define it for us.
Well, picture those spots inside, say a CVS or a Walmart, sometimes even airports.
Okay, yeah, convenient locations.
Definitely. And they're usually physically and administratively separate from hospitals. They tend to have longer hours, too.
First come, first served, generally.
Typically, yes.
Yeah.
Designed for those less critical issues you mentioned.
Like coughs, colds, flu, maybe a minor sprain.
Exactly that kind of thing. Sore throats, allergies, sometimes basic screenings or tests.
And the study mentioned cost, right? That seemed quite low.
Yeah, somewhere between $40 and $75 per visit, typically, which, can be a lot less than going to your primary care doc.
Huge difference sometimes. And who's actually providing the care there? Is it doctors?
Usually it's what they call physician extenders. So highly skilled nurse practitioners, physician assistants, they're qualified for a lot of common stuff.
Okay. And these clinics aren't just in major cities.
No, they're pretty widespread. Urban, rural areas. They usually take various insurances too, like commercial plans, Medicare, Medicaid.
The scale sounds pretty significant.
It is. The numbers are, well, impressive. Over 10 million visits a year across something like 1,800 clinics.
Wow, okay. And each clinic sees a fair number of people.
Yeah, the estimate was around $500,000 in revenue per clinic annually. Daily patient volume, maybe 10 to 30 people.
So what's the big appeal? Why choose them over, say, your regular doctor for these issues?
Well, convenience is massive. Just walking in, no appointment needed.
The location helps too, being right there in the store.
Absolutely. And the hours. Plus, the cash payment option is a big deal for some folks, even if they have insurance.
Interesting. And the study pointed out something about the users, didn't it? About insurance and primary care.
It did. People using them for this kind of acute care are often, well, less likely to have insurance or a regular primary care provider.
So they're really filling a gap.
Seems like it. Providing access for people who might otherwise just wait it out or, not get care.
The study also mentioned families with kids use them a lot.
Yeah, that makes sense, doesn't it? Kids get sick suddenly, need quick attention.
True. But there are downsides, potential challenges with this model.
Yeah, the main one flagged is often the lack of coordination. Making sure your main doctor knows what happened at the clinic.
Right, connecting the dots in your overall healthcare.
Exactly. And the focus is very much on the immediate problem, the acute issue, maybe less on long-term health or prevention.
Okay, that gives us a good picture of the walk-in clinic scene. Now, tell me more about this Cano model you mentioned. How does that help understand patient needs?
Right, the Cano model. It's a neat way to look at service features and how they actually impact satisfaction. It's not always straightforward.
Meaning more isn't always better.
Kind of, yeah. It's just different features affect satisfaction in different ways.
Yeah.
It's often nonlinear.
Okay, so it's not just good, bad. What are the categories it uses?
There are 5 main ones. First, attractive attributes. These are the pleasant surprises.
Like a bonus feature.
Exactly. If they're there, you're delighted. If they're not, you're not necessarily unhappy. You didn't expect it anyway.
Got it. What's next?
Then you have one-dimensional attributes. This is more like what you'd expect. Better performance equals more satisfaction. Simple relationship.
Okay, like shorter wait times make people happier.
Precisely. A lot of the things in this study fell here. Then there are must-be attributes.
The absolute basics.
Yes. You take them for granted. If they're missing, you're very dissatisfied. But if they're there, it doesn't really boost satisfaction. It just meets the minimum expectation.
Like having clean facilities. You expect it, you don't get extra happy if it is clean.
Perfect example. The study found appropriately qualified medical staff was a key.
Yeah,
Must be. You'd be pretty upset if they weren't qualified, right?
absolutely. Essential. What else?
They're also indifferent attributes.
Hmm.
These just don't really matter much to satisfaction either way.
Things people just don't care much about.
Pretty much. In this study, accommodating religious or cultural restrictions mostly fell into this category for the surveyed population.
Interesting. And the last one?
Reverse attributes. These are weird ones. Having them actually makes people dissatisfied.
Huh. Like what?
Well, thankfully, they didn't find many significant ones in this study, which is good. You don't want features that actively annoy people.
Definitely not. Okay, so this Kano model provides a much richer picture. And you mentioned better and worse coefficients.
Right. Those come from the survey questions they ask about having the feature functional and not having it dysfunctional.
Okay.
The better score shows how much satisfaction increases if the feature is there. Closer to 1 is a bigger boost.
And worse.
That shows how much dissatisfaction results if it's absent. Again, closer to 1 means its absence really hurts satisfaction and makes people unhappy.
So a high worse score tells you it's probably a must-be or one-dimensional feature you can't mess up.
Exactly. It quantifies the impact.
Okay, so applying this whole framework to the walk-in clinics, what did this study actually find? What were the big results?
Well, they surveyed patients on 21 different service quality aspects using those Kano questions and asked demographic stuff too.
Right. And how did those 21 things break down?
A big chunk, 15 of them were one-dimensional. So do better, get happier patients. Pretty straightforward.
Okay, the majority.
Yeah. Then 3 were indifferent. But the really interesting ones were the others. They found 2 attractive attributes.
The delight factors, what were they?
Getting access to qualified medical staff within 10 minutes of checking in. That speed was a delighter.
Quick service. Makes sense. And the other?
The availability of after-hours care. Being able to get help outside typical 9 to 5 hours.
Okay, so speed and extended hours, those are bonus points.
Mm-hmm.
What about the absolute essential must be?
Just one emerged strongly. Having appropriately qualified medical staff, period.
That really hammers home the point, doesn't it? Confidence is non-negotiable.
Absolutely. It's the foundation everything else is built on.
Did patients offer specific suggestions for improvement too?
They did. Some common themes were more flexible payment plans.
Okay, addressing that cost factor again.
Right. Also, making sure staffing is adequate to keep wait times down.
Yeah.
And, just making the waiting room more pleasant, maybe a TV, some magazines.
Basic comfort things while you wait. Seems reasonable.
Yeah, practical stuff reflecting that desire for convenience and a decent experience overall.
Now let's talk about the demographics. You said they analyzed how different groups responded. That sounds crucial.
It really is. Because, not everyone values the same things equally. They use stats to see if things like gender, age, citizenship made a difference.
And did they find significant differences?
Oh, yeah, definitely. Take gender. Men and women responded differently about staff availability, getting updates on delays, and info about medications.
Really? How so?
Well, the association was relatively strong between gender and how important staff availability and delay info were. Maybe different communication preferences or expectations.
Huh. That's a practical tip for clinics right there. What about age?
Age showed differences too, particularly regarding the facility design, like comfort, layout, also getting clear info about their illness, treatment, and again, medication details.
So younger versus older patients might focus on different aspects of the experience?
Seems like it. There was also a moderate link between age and wanting clear follow-up instructions. Makes sense. Maybe older patients need that spelled out more carefully.
Yeah, or patients with more complex conditions, potentially. Okay, what else? Citizenship.
That one was interesting. A significant difference and a relatively strong link, specifically with how patient-friendly the facility design felt.
Wow. So maybe cultural background influences perceptions of the physical space.
Could be. It suggests clinics might need to think about creating a universally welcoming environment.
Fascinating. Any other groups? Marital status? Parental status?
Yeah. Marital status seemed linked to views on staff availability, illness treatment info, and just overall confidence in the care. Moderate associations there.
Okay.
And parental status, being a parent or not, showed a difference specifically regarding getting complete medication information.
Ah, makes total sense if you're managing meds for a child. You want all the details.
Exactly. And also a moderate link between being a parent and noticing staff sympathy. Perhaps parents are more attuned to that interpersonal
Could
aspect.
be. What about people's general health? Did healthier people view things differently than less healthy people?
Not so much in their ratings of specific attributes, but there were moderate associations between self-reported health status and things like the importance of qualified staff, whether staff checked on their satisfaction, and overall confidence in care.
So maybe not impacting views on, say, waiting time, but influencing their overall trust and feeling about the quality.
Yeah, something like that. It suggests their general health might frame their underlying perception of the care's reliability and quality.
Okay, so stepping back and looking at all of this, it's really clear that just asking, were you satisfied, barely scratches the surface, doesn't it?
Not at all. These clinics, they absolutely fill a need, right? Accessible, affordable care for immediate problems. We see that.
Yeah, the convenience is undeniable.
But this study, using the Kino model and looking at demographics, shows that excelling means understanding these different layers of need.
It's about knowing what's a basic expectation versus what actually delights people.
Exactly. And knowing that different people might prioritize different things, those attractive qualities, fast access to qualified staff, after-hours care, those are powerful levers for satisfaction.
And recognizing that, say, parents might care intensely about medication info, or that older patients value clear instructions.
Precisely. It's about tailoring the service.
So for you listening, wanting that quick yet thorough understanding, hopefully this deep dive gave you that structured insight into patient quality. It's all about the voice of the customer or patient here.
It really is. Understanding what they truly value, not just what you think they value.
So here's a final thought to mull over. How could these kinds of insights, understanding basic needs versus delighters, and how different people value different things apply elsewhere?
Yeah, think about other services you use or even interactions in your workplace or community.
What are those seemingly small things that might make a huge difference to someone's satisfaction or dissatisfaction? What are those unspoken needs?
So something to think about, definitely. Looking beyond the obvious.